Good morning. My name is Jim Bunker. I'm an accredited claims agent. This is my address. Gulf War claims under 3.317 are undiagnosed illnesses passed by Congress in 1994, medically unexplained chronic multi-symptom illnesses, which is Section 2B, passed by Congress in 1991 that took effect in 2002, and then infectious diseases which affect both Gulf War veterans and veterans in Afghanistan, which was added by the Secretary in 2011. You cannot file a claim for Gulf War illness. It's only a term used to cover all illnesses affected by Gulf War veterans. VBA will send you a letter asking what body parts or symptoms you are claiming. This is found within the M21 manual. VA no longer uses the M21 MR. If you see anybody referencing that, they're not an accredited person or they're using very outdated manuals. You need to respond to this letter or your claim will be denied. Please see our guide on page 16. These are references I use. The court will always go back to the federal law, which is the USC 38, sections 1117 and 1118 covers Gulf War claims, and the CFR 3.317. The Federal Register listed here is when the original claim was put into act, and then the one in 2003 is when the CFR was changed to add the chronic multi-symptom illnesses. Within that you will see that it is not tied to any exposures in the Gulf. Court case in 2004 is where one of the major ones, and it will show that you do not need a nexus to your service on these conditions. It also explains about presumptives. 2006 is where you do not need medical evidence showing the illnesses, because they were trying to say that a veteran didn't reach 10% because he didn't have medical evidence in an x-ray showing joint problems. They were using the criteria for arthritis, and then they said they should be using fibromyalgia, which showed that. Joyner says that you don't have to have multiple tests forever. A limited number of testing show that a non-diagnosed illness is okay. 2005 research is on GERDs. VA longitudinal studies are the next two, showing higher rates than the M21 Life manual is what I use. You can never use that in an appeals case. It's just for references that we use as claims agents. Gulf War claims, what caused it? You don't have to worry about that because you cannot ascribe a cause. Your illness is presumed. Presumption of illnesses means that there is no known cause. If you have it, all you have to do is prove that you have it, and then that it reaches 10%. Only a doctor can give you clear medical reasoning. You cannot say that my illness is caused by an anthrax shot, or my illness is caused by DU, or my illness is caused by any exposures in the Gulf. Only doctors can prescribe causes. The VA can rebut any nexus that a doctor gives to your illness. Always remember that the VA has the right to do that, because the VA technically has all your medical information from your service. These are all the toxins are some of the toxins that was exposed to you while you served. You may or may not have been exposed to all these toxins, or a combination of these toxins. In 2010, the IOM Volume 10 stated that there were too many multiple toxins for anyone to be able to decipher out which one or multiples of these toxins caused the Gulf War illness within the veterans, and that is why it's going to be impossible to determine what caused the illnesses that the veteran suffers from. That was in Volume 10. These are some of the illnesses in the last longitudinal study done by the VA on the 30,000 veteran studies. You'll note that asthma and migraine seizures are at much higher rates for the deployed versus non-deployed. You'll also note that you have coronary artery disease, hypertension, but they listed PTSD, there's research that shows coronary artery disease, hypertension um, is caused by PTSD or is associated with PTSD at much higher rates, any mental disorders, and then have these illnesses. It's a VA's large studies you can find on their blog sites. But you always have to have a doctor nexus. You cannot just say, my headache is caused by my deployment because of these studies. You do need to have a doctor nexus between the two. And the fact that it's mere without, there's no way they can put it to any exposures in the Gulf without mere speculations. And you also have to turn in the study with a write-up that these studies shows this at a higher rate. The same thing as if you try to get anything related to PTSD, you have to say the medication as well, the treatment for the PTSD as well as PTSD. Undiagnosed illness is a term given to our symptomologies by Congress. Idiopathic illnesses, illnesses of unknown etiology is what it really is. An example would be idiopathic neuropathy is an undiagnosed illness. Dermatology of unknown etiology would be an example of skin problems. Those both fit within the law as passed in 1994. These are other things. These all come out of the CFR. The requirement is that it has to either start during the Gulf War, and if you put down that my illness started in Desert Storm, you'll have to then, that's called direct service connection, you have to show records in your service records. But being that it's presumptive, then it only needs to be 10% or more during the time period, which ends in 2021. So all you have to do then is just show that you meet the criteria underneath the law. The exclusionary time parts is if there's affirmative evidence the disability did not incur during active military service and self-defeating operation. That is, if your records show, or if you tell the examiner, I had these symptoms prior to going to Desert Storm or Desert Shield, that's an exclusionary factor because the symptoms or the illness started before you ever deployed, which takes you out of the presumptive period, or if it's in your records. The other two parts here comes out of the USC 1113, which is the right for the VA to rebut any of the presumptive illnesses. Willful misconduct could be alcohol abuse, and which IBS can be tied to that. A lot of the symptoms for the undiagnosed illnesses are shared with fibromyalgia, chronic fatigue, and IBS. The undiagnosed illness law was passed before fibromyalgia or chronic fatigue became parts within the CFR. IBS was always there. It was used to be called something else as the names changed. Raters aren't keen to medical diagnoses, and that's where we have the problems. But if you look at the first column and come across in our guide, you will notice how the symptoms are all shared. The main ones that aren't is skin disorders and menstrual disorders, but most of the others are all shared within these. The key is in fibromyalgia is that some of these have to be rated as secondaries, and you need a doctor's nexus on that, which is also covered within the guide. The other part is that some of the undiagnosed symptomologies can be attributed to illnesses that you may already have. Chest pains is you find within GERD, which is not a presumptive to the Gulf War. Heart attacks, COPDs, and neurological problems. If you have any of those, you cannot claim chest pains, and you cannot claim any of these other illnesses in the right-hand column. Fatigue can be because of PTSD, because it gives you a higher rating in PTSD or any other mental disorders. It can be because of medications you take, sleep apnea, anemia, thyroid disorders. If you have any of the ones on the one column, you cannot claim the other column. Memory, cognitive problems, TBIs, medications, mental disorders, sleep disturbances, PTSD because of the fact that you have the flashbacks, nightmares, sleep apnea, insomnia, restless leg syndromes. They also blame it on shift work, unfortunately. Joint pains, again, you'll see arthritis, rheumatoid arthritis, osteoarthritis, and sometimes cancer. We see people file for joint pains. They go in for file for the joint pains. They file for some of these without ever seeing a doctor. They go in for a CMP exam, find out they got cancer or they have rheumatoid arthritis, which, because it's a diagnosed illness now, and first time they come to see a doctor and they get denied. Skin disorder is the one that people have a hard time with because they go to the doctor and the doctor doesn't take good notes. They don't put down how much of the body is covered by the skin, or that the skin disorder might only cover a little bit of their hand or something, less than 5% of their exposed body, or less than 5% of their body. It's just a little patch on their skin. Remember, you have to get 10% of the body, or 10% rating. If it's less than 5% of your body, that's not even a 10% rating. And then the other part is the doctor doesn't document, doesn't get pictures into the medical files, doesn't say that it's covering X% of the exposed body or something, and it becomes hard. Also, if the skin disorder is diagnosed as being from a fungal or bacterial or insect bite or plant, then it becomes a diagnosed portion of the thing. Problem that sometimes you run into is you walk into a dermatologist, they look at you and say, oh, that's because of scabies or something, and not do any tests, and it excludes it. If they don't do the test, you fight the claim because they didn't do a clinical diagnosis, which means in a skin disorder they got to run the test. Medically unexplained chronic multi-symptom illnesses. These are listed as examples: chronic fatigue syndrome, fibromyalgia, and IBS. You have to make sure you have all the proper testing done before you file these claims. You make sure you point out the proper testing was done, and you have to make sure you have a proper diagnosis with these. Make sure it's done by an expert in the field, not a nurse practitioner. Make sure your diagnosis for chronic fatigue syndrome is done by a doctor there. You don't get a diagnosis from a psychiatrist. Psychiatrists cannot diagnose these illnesses. Make sure you have a GI doctor who diagnoses you for IBS. Make sure when you write your statement in that you point out that it was a GI doctor who's an expert in the field to diagnose these. Make sure you do it 3148. Make sure you do statements in case about your symptomologies. Please read the guide on that. CMIs of partially explained etiologies are not allowed under the law. Diabetes, multiple sclerosis was specifically addressed when this was passed in the legislation. And that you'll find that within the Federal Register. You'll also find it within the CFR. Fibromyalgia, the only requirement is widespread musculoskeletal pain. That means in the upper, lower, left, and right of the body. Secondary to fibromyalgia, you need a doxor nexus, headaches, numbness, tingling, bowel, bladder. IBS has its own diagnostic criteria, but you can also get a nexus to that because sometimes the VA wants to put it underneath it as part of it. GERDs maybe, but remember, if you have IBS at 30%, if you do get GERD service connected, it's a 0% anyways. Symptomology, if they say that your depression is secondary to the pain from IBS, or your pain from fibromyalgia, you can get depression secondary to, or anxiety disorders. Chronic fatigue syndrome, debilitating fatigue, which is not caused by any other factors. IBS has exclusionary criteria: cancer, inflammation, Crohn's disease, ulcerative colitis, alcohol abuse. These are exclusionary factors that if they find these in your records, you have to rule these out with tests before you can have the diagnosis and before you file the claim. These found in your records will cause the claim to be denied. Medical evidence. Medical evidence of a non-diagnosed illness includes, but as per the law, time lost from work, sick reports, lay statements from the boss supervisors, and private messaging through the e-benefits to your notes, patient notes on treatment that you've tried and hadn't worked, um, x-rays and medical reports trying to diagnose the illnesses and were not able to. Medical evidence of observed symptomologies. These are the different court casings holding that a layperson is competent to provide information regarding visible and otherwise observed symptomologies. This comes especially important in a claim for skin disorders because some VAs don't want to use your evidence saying that here are photographs showing the skin is obviously covering more than 40% of my exposed skin or exposed parts of the body. These court cases come and are very important in these areas. Medical evidence of an inadequate exam. A medical examination is considered inadequate if it fails to consider competent lay evidence. That's if you have an IBS claim and when you filed it, you put in there how you have severe abdominal cramping and everything every day, and you go to the restroom 5-6 times a day, like every day or every other day with severe diarrhea, and your medical reports show that you are always having diarrhea, and they tried different medicines and fibers and everything like that, and none of it's been working, and they don't take that, and the examiner says, well, there's no evidence that you have diarrhea. They didn't take the medical statements into consideration. That's an inadequate exam. Same thing with inactual factual premise. If you have fibromyalgia and you've been going into the doctor on this and he diagnosed it and you had the symptomologies for 6 years before in your medical records, and then the doctor says you've never been diagnosed with fibromyalgia in the examination, that's an inadequate examination that was not based on medical factual evidence, and that exam is not of any probable value and should never be considered in the rating basis, and you have to address these from day one before you even go to the board. Okay, a good service officer will know this, and you point these cases out and talk to your service officers. A famous court case for Gulf War things, a competent lay evidence has to be used. There's lower standards for Gulf War claims underneath this, only if you have a properly diagnosed, undiagnosed symptomologies, or if you have a properly diagnosed chronic multi-symptom illness. Symptoms based by the wife and when symptomology started. You don't have to prove any of the exposures within these claims, and VSOs, you need to know about these. This is found within our guide. Okay, lay evidence is very important. Okay, lay evidence must be sufficient to establish service connection of symptomologies, credible lay observations, for example, fatigue, joint pain, skin rashes, and so on. Undiagnosed illness claim. Here I talked about this earlier. Okay, decision must explain why one diagnosis is used over another. Diagnostic codes must take into account the nature of the undisclosed illness. It's inappropriate to require objective evidence of a diagnosed disability. That is like X-ray proof that that your illness is there, or lab test that shows that you have the disability. Notice the disagreement. Okay, my record shows that I am on medication for fibromyalgia. If you have a diagnosis of fibromyalgia and your records show that you're taking medication for it, that means you met the 10%. If your records also show that in your doctor reports that you're still refractive to the medication, otherwise that you're in pain almost all of the time, that means you're eligible for a much higher thing. And if the raters fail to utilize your records, okay, they fail to adhere to the principles of the law of 2004, or the court case of 2004. As a Gulf War veteran, my fibromyalgia is a presumptive. You need to put this within the NLD if they denied it, saying that it wasn't related to Gulf War. I don't need a nexus if they said that you needed a nexus to the service or it wasn't in your service medical records. Don't forget, you need a nexus for chronic multi-symptom illness as a partially understood etiology, or if it's a disease of clear and specific etiologies like sleep apnea, GERD, migraine. Service connection for IBS to include as claimed as due to exposures in the Gulf War. Okay. The available service treatment record shows no treatment or diagnosis of any chronic multi-symptom illness. There is no other complaint. This is a denial. We made an error in that claim. We reapplied the principles of the law and was able to get the earlier effective date for the veteran. And the veteran got a lot of back pay for that. It went all the way back to when he first filed. These are the cases I talked about. The longitudinal studies that showed in 2000 and in 2016 much higher rates for migraine, sinusitis, and seizures. Use those studies, show them to your doctors, and ask very nicely, Doc, do you think that my migraines are at least likely as not related to my exposures, multiple exposures, remember multiple exposures to the Gulf War? And if he agrees, because based on the studies, Dr. Dursa's study in 2016, which you would have to use now, the two studies together, one showing higher rates of headaches, Dr. Dursa's study showing within one area will address specifically the migraines and seizures and that at much higher rates, and then get the nexus. You also submit a statement that you believe that your headaches are much higher rates due to the multiple exposures, not any one exposure, but multiple exposures, and you have to submit both studies because the VA has to address these studies also. You need a nexus from your doctor too. Claims research. Claim filed for migraines. Okay, the veteran had years of medical records. Claim was denied. No records in the service. Okay, we helped out and got the claim service connected. That's because we got the nexus letter from the doctor. We used the research and wrote up a reason for. Okay, example research. We told the veteran what to do. We got the NLD written up with the veteran. We used these studies. We also used the Kansas study because the Kansas study also showed that migraines was at over 2 times the rate in deployed versus non-deployed. Okay, or at least in the deployed veterans. Okay, the veteran did get a nexus statement from the doctor because of the studies. The claim was written up and went to the BVA. The BVA agreed that it was at a higher rate and the claim was granted. Direct service connection, okay, you need to have a nexus. Secondary service connection is caused by or aggravated by, and when you ever file a secondary, you always have to say something is caused or aggravated by my illness or the treatment. Always remember treatment for and the limitation of your abilities. We have that written in here. Remember that sleep apnea is at a higher rate in Gulf War veterans, Desert Storm veterans mainly. And that's at a higher rate because we have a lot of pains. We're on a lot of medications for pains, such as pain meds, muscle relaxers. We are given antidepressants to help fight some of the problems with fibromyalgia and stuff. Fatigue after we work out. If we try and work out, we are in bed for a while. If we do a lot of work with brain and all that, we have breathing problems, and all of that has to be played in together. You do need a nexus from a doctor. You have to remind the doctor of everything that you're on. You should talk to your sleep doctor maybe, not the tech working the machines and all that, but actually the actual sleep doctor or your pain medication doctor if you have one, about all this, and if it's at least likely as not that caused the problems with the weight gain and the sleep disorders, and how muscle relaxers can depress your problems with sleeping. This is a sample of an NOD that was done up for sleep apnea. This is found within the book. Also remember that the IOM found some things due to the exposures of the petroleum products, benzene, solvents, and all that, which is in the IOM book. And these are the ones that you can look for. And since these were the slides I was going to present yesterday, remember that you do need all of this.